Welcome, Dr. Stevenson. How are you today?
Great.
Wonderful.
Nice to be here. Thank you.
So today we're going to be talking about a stroke. How do you know if you're having a stroke? What are the risk factors and treatment for stroke? So I think probably the first question would be, how do you know if you're having a stroke?
Well, a stroke, and we're using the terminology brain attack now more days to make the analogy between a heart attack and the emergent situation that a stroke truly is. But a stroke basically results from interruption of blood flow to part of the brain. So the symptoms of a stroke are those of misfunction or malfunction of a part of the brain. So weakness on one side of the body or the other, clumsiness that comes on suddenly, loss of sensation, profound dizziness, loss of control of one leg or the other, loss of speech, loss of vision, all coming on fairly quickly could be symptoms that the person is having a stroke.
Now, I remember hearing of someone close to my family having what they called a TIA.
Yeah.
Is that the same thing as a stroke?
You know, it used to be we'd talk about strokes, we'd talk about a TIA, which basically is a stroke that clears up without any residual symptoms within 24 hours. Then there was other entity called a reversible ischemic neurologic deficit. So if your symptoms cleared within a week, you had a RIND.
Okay.
But really all of these are the same thing, leaving more or less deficits behind. And, you know, strokes are plumbing problems. A blood vessel either gets plugged, and that's the majority of stroke, or sometimes they break, like a pipe breaks, and that's what we call a hemorrhagic stroke. But, you know, both result in interruption of blood flow to a part of the brain.
I think because I'm not sure if it's that people don't have the same understanding or we hear about mini strokes or that sort of thing, but at least in my mind there's this impression that it's not as important to get treatment quickly when you're having a stroke as it is when you're having a heart attack. Is that a myth?
It is now a myth.
Okay.
In the past, there was very little we could do for somebody who was in the midst of having a stroke. But with the advent of clot-busting agents, TPA, we know that people who get to the hospital and are administered TPA within 3 hours of having the onset of their stroke symptoms can end up doing better in the long term. This doesn't just make the stroke go away, but people recover better in the long term than people who don't get the TPA. And so finding a facility, getting to the hospital as quickly as possible has now become important. Now, I have to caution that TPA is not for everybody because there are some risks involved. But, you know, getting to the hospital to be evaluated whether you are or not a candidate quickly as possible is very important. Sort of head to the emergency room, do not pass go, do not collect $200. I mean, I've had people who came in to me and said, yeah, my right arm got weak 3 days ago, but I thought it would get better. Guess what? It didn't. And they're going to be left with a persisting deficit. Possibly, they could have been better off if we'd been able to treat them quickly, but they have to get to the emergency room. The problem is that a stroke doesn't hurt.
Okay.
People go to the emergency room with a heart attack because they're experiencing some discomfort. And for the most part, strokes don't hurt, so people tend to stay home and wait to see if things will get better on their own.
Okay.
But getting to the emergency room for rapid treatment is increasingly important.
Does the intensity, I guess, of the symptoms when you're having the stroke, is that an indicator of how severe a stroke you're having? Or I guess that what I'm trying to say is whether or not you'll be able to get better, whether or not they'll go away.
There are a lot of different factors that determine how severe a stroke will be. The side of the brain that is affected by the stroke. For most right-handed people, and many, many left-handed people, language function is on the left side of the brain. So a stroke that affects language function really leaves somebody very, very significantly impaired. A stroke that affected the right side of the brain in the same region might leave you with weakness in an arm and a leg, but still able to communicate with others. So, you know, and if you're a concert pianist, something that bothers your right hand a little bit can be devastating.
Right.
So it depends on who you are, what you do, and of course the severity of the stroke.
All right. So at what point in time do people say, boy, I really think I'm having a stroke, I better get to the emergency room? Weakness on one side? I mean, is there a laundry list?
There's a laundry list, but basically, you know, weakness, dizziness, loss of function, an abrupt loss of bodily function, whether it's vision or strength or coordination or sensation, ability to walk. You know, if I had any of those symptoms, directly to the emergency room is what I'd be doing for myself.
All right, wonderful. So to finish up, can we talk about what are the risk factors for stroke? How do we prevent ourselves from being at risk for stroke?
Yeah. There are a whole host of different risk factors, and we can divide them into changeable risk factors or modifiable risk factors and non-modifiable. I can't change the fact that we're all getting older each year.
Right.
I can't change anybody's parents.
Right.
Okay? I can't change anybody's gender. Okay? And those are all risk factors for stroke. But beyond that, blood pressure is a risk factor for stroke, high blood pressure that can be modified by medications, by diet, by exercise, and it's certainly something that you want to see. And you know, I've been doing this for some time, and frankly, we don't see the horrible, devastating strokes that have been attributed to high blood pressure in the past as commonly now that blood pressure management is more well regulated. So that's certainly one factor. Cholesterol management is another factor that can be modified by medication. Cigarette smoking. People who smoke cigarettes increase their risk of having strokes by 2.5-fold.
Wow.
I mean, all we can do with medicines is maybe a 30 to 40% reduction. And so stopping cigarette smoking is going to be the best thing you can do for yourself if you're worried about having a stroke. If you're diabetic, controlling your blood sugar is very important for stroke prevention. Beyond that, in terms of medication, aspirin is a very beneficial medicine for somebody who's had a stroke and does not want to have another one. There are 2 other prescription medications that can be taken for people who don't tolerate aspirin or for whom aspirin is not adequate. And exercise. We know that people who get routine exercise, and this is 30 minutes of fairly vigorous exercise at least 4 days a week, are at less risk of having strokes than people who don't get that exercise. So all of those things are modifiable, things that you can do for yourself, things that you and your physician can do together.
So it sounds like a lot of the risk factors for stroke are the same as heart attack, so hence heart attack, brain attack, because they really are a similar mechanism?
In both situations, it's a plumbing problem. Blood vessels get plugged up. The target of those blood vessels is deprived of its oxygenated blood supply.
Wonderful. Well, thank you very much. That was some really, really good information, and hopefully we can get the word out that, you know, brain attack, change it from stroke to brain attack.
Exactly.
Wonderful.
Exactly.
Thank you very much.
You're very